Hey everybody, this is Dr. Monica Du, pediatrician here. Today I wanted to discuss diaper rash. This is a very common, annoying condition that many of our babies face. Now, diaper rashes can come in quite a few different forms. Most oftentimes we're going to see very red, irritated, sometimes bumpy, and even itchy, uncomfortable, moist appearing area in that diaper region. Most often right up underneath the creases of the diapers. Sometimes it can even involve the inguinal folds, kind of where all that nice, chubby skin is, where they are meeting and touching. That can be definitely an interface for that itchy, red, annoying diaper rash. Now, the most common is going to be your irritant diaper rash, which is oftentimes because all the urine and bowel movements that they make, sometimes it can set on that skin for a little longer than we would have liked, and that then tends to irritate the skin, can cause chafing, redness, bumps, and just an uncomfortable and even sometimes open areas to the skin if it gets very irritated and excoriated. And with that, of course, is going to come uncomfortableness for the baby. So when this occurs, you want to make sure that you're changing the diapers frequently and then putting on a barrier cream or ointment. Most often, you're going to find one that contains zinc oxide, which is a nice emollient and barrier cream that has healing properties. So whichever diaper ointment that you choose, make sure that you see the main ingredient to be zinc oxide, which is definitely a great help in the healing process. Other barriers that you can also use, of course, is something with petrolatum or petroleum in there. It's just another safe ointment that you can use on the skin, non-medicated, that just serves to provide a nice layer between baby skin and the oftentimes kind of caustic environment that can happen with the bowel movements and the urine that is, a common a part of their day. Obviously, they have um, these movements every day, so it's something that their skin will always be in contact with. So definitely try one of the barrier creams. That's the main thing. You want to make sure that you have a barrier there. And don't be afraid. Put a thick layer right on the diaper area, bottom, creases, everywhere, just to make sure that you have a nice layer between their skin and the diaper. Another thing also to consider is the type of diaper that you're using. Sometimes the diaper can be even irritating and it doesn't wick the moisture away from their bottom as we would like. And then what happens? Yeast and bacterium can grow there, and then you can have a nasty rash, not just your common one, but it can get to be even infected there. So another thing, make sure that the diapers that you're buying is extra absorbent so that way all the moisture gets wicked away, and then that way you don't get set up with that moist environment that these organisms like to thrive in. So just, take a closer look at the diapers that you buy. And then red flag signs, if the diaper rash is not clearing and is starting to look very raised, papular, or bumpy, that's when you should go ahead and let your pediatrician take a quick peek at it because it might be something that you need medication for, prescription-wise, that you cannot get over the counter. For example, if there's some yeast growing there now, some candida, that means that you need a nice prescription medication that can definitely get you the results you need. And then, rare instances, if it becomes infected, if the skin starts to break open, starts to become weepy, then what happens? We have bacterium all over our body, including, of course, the diaper area where all that stool is present. You can have bacterium there that can then get inside those open areas on the bottom in the groin area and cause infection. And that is going to be red, sometimes weeping area, open areas, very uncomfortable. If you ever, rarely will you see pus, but if ever you saw that, that is something that you need to let your physician take a look at because they're going to need something antibacterial to place over there in addition to the barrier creams. Otherwise, it will not go away and it's going to be very uncomfortable, and we never want it to get to that point. But those are red flag signs. If ever you see any of those things, and of course, if baby's having a temperature rise, fever, then let your physician take a look, because there can be other skin related infections that can be threatening to their health and well being. So, if the diaper rash is not looking like your common kind of irritant red looking area, then let your pediatrician take a look. All right, I hope that that definitely helps you all out there. It's a common problem that all of us face, and it can be easily prevented if we just know the right tools that we need to use. All right, you all have a wonderful day.